Hi everyone, I'm Nahim Khan. I'm a senior lecturer in the Public Health and Wellbeing Department, and thank you for joining me today on a talk on a brief introduction on pharmacology, live from my kitchen. Um, so um, I'm happy to answer any questions you might have at the end. So before we go into any detail, I have two questions for you. You've probably seen on TV adverts saying if you have a headache, then take some ibuprofen and it'll make you feel better. But have you thought about why ibuprofen works, or even how does ibuprofen even know to help, say, a headache? So we'll be looking at the principles that will help you, or hopefully help you answer these questions by the end of this presentation. So first of all, let's look at some definitions. So first of all, let's look at pharmacology. Pharmacology is simply the interaction of drugs with living systems. You might think that pharmacology is just about how drugs work, but that's actually only one aspect. It's also how what the body does to the drug. So I like to think of pharmacology as a two-way street. And pharmacology can be split into two parts: pharmacodynamics and pharmacokinetics. Pharmacodynamics means what the drug does to the body, and pharmacokinetics means what the body does to the drug. So let's first look at pharmacodynamics. So we're going to start big and zoom into your body. So your body is made of systems, whether it's circulatory, respiratory, or the nervous system, or even digestion. Systems are made up of organs which have specific functions in the system. Now, each organ is made up of tissue, and each tissue is made of individual building blocks, which are cells. What controls the normal physiological functioning of the body is cells and proteins. So most proteins are distinct to particular organs or systems in the body, and therefore they make good targets for drugs. There are four main protein groups that drugs bind to: receptors, ion channels, carrier proteins, and enzymes. So how do drugs work on these proteins? How do they know to go there and bind to it? Well, simply, it's all in the shape. So just as the shape of a key, so I've got a key and a lock here, just as a key fits into the lock, that's how we think that drugs bind onto the target. It's all based on their shape. So, moreover, whether a drug binds to its target activates the target also depends on the shape, just like a lock. So I've got a key here, goes into lock and opens it. So that's how we see as a drug binding onto the target and activating it. Moreover, whether a drug activates. Sorry, an example is adrenaline, which is the right shape to bind onto receptors in the lungs, and once bound to, it activates the receptor and causes the smooth muscle in the lungs to open up, and that's how you breathe a lot better. So someone who has got asthma and their lungs have been constricted because of a lot of inflammation, we can give something that is a similar shape to adrenaline, and that in an inhaler, and that will bind onto it and activate the receptor, causing similar activity such as the adrenaline. So it'll open up the airways. Now, in some cases, we can also block these proteins, the drug targets. So going back to the lock and key, have you ever put in a similar shaped key? It fits the lock pretty well, but it kind of just hasn't got the right shape to open it. So that's the way how we can block some receptors as well, or some proteins. Just as a very topical subject, and why I'm presenting in my kitchen is because of the virus pandemic. So basically, the bit of the virus, the protein, the spike protein, which attaches onto the receptor into the lungs, is very similar to a receptor that we've got, and that's how it's able to attach onto and infect the cell in the lungs. So let's talk about pharmacokinetics. So again, pharmacokinetics is what the body does to the drug, and we can classify that into 4 stages. And we have absorption, distribution, metabolism, and elimination. So taking a drug orally through the mouth takes advantage of our digestive system. It's also very convenient way to take medication. So just as we swallow food, it gets digested into small molecules, into the building blocks. Drugs also use a similar process. So I've got a multivitamin here. I'm using this because this will get into some water, and I'll be able to show you how it's suspended. And I have a beaker of water, and I'm going to pop that in. Now, this doesn't happen with much vigorous activity in your body, in your digestive system, but for the purposes of being very quick, it gives you a good idea. So as you can see, the color of the water has changed, and in that solution is the drug suspended. So I'm going to put that over there. And once it's suspended, it's small enough to get absorbed through the gut. So after that, it gets absorbed, it goes into the blood. And if you think about it, again, blood carries oxygen all around the body. So we're using a process that's there already to allow that drug to travel all around the body. The last 2 stages, metabolism and elimination, are about removing the drug from the body. So metabolism makes some changes to the drug molecule, which make it more water soluble. So this primarily happens in the liver, and then when the changes have occurred to the drug, it's able to be eliminated from the body through the kidneys into the urine. And we think about the urine being a very watery environment. And so once the changes from metabolism occur to become more water soluble, the drug then is able to stay in the urine and then pass out of the body. So, looking back at the two questions, how does ibuprofen work? It's able to, when you swallow a tablet, it goes into the stomach and the digestive system where it is absorbed into the blood. Now, does it know where to work? No, it doesn't. However, the shape of the drug itself means that it's able to bind to a target and then have its pharmacological effect. So what ibuprofen does is that it binds to an enzyme, which is essentially a protein, and inactivates it. That enzyme is called cyclooxygenase, and cyclooxygenase is responsible for inflammation, causing inflammation. So when you inactivate the enzyme, it stops the inflammation from occurring. So when you see adverts saying, well, take some ibuprofen, it's great for your back, it's great for your head, it doesn't actually matter where the pain is. It will simply stop any inflammation that's occurring. So when you see adverts for ibuprofen working for the back, it doesn't necessarily go straight to the back. It will go everywhere around the body where it's able to bind to because of its shape, and then work its pharmacological effect. So another problem we have then is if it is able to go all around the body, is that it will work where we don't want it to work. So in the gut, it will work wherever it can. And one of the side effects of ibuprofen is that it can cause some gastric irritation. So that's something that we need to be aware of when we are prescribing, or if anyone is taking ibuprofen, is to let them know. So why is knowledge in pharmacology important as a healthcare professional? Medication is now the most common medical intervention. Before we had these very useful drugs, if someone, for example, had a heart attack, then the best we could probably recommend is some bed rest. But now that we've got some very good evidence-based medication, it really improves the chances for that person. It also, having a knowledge in pharmacology makes us able to understand how drugs work and be able to discuss with patients to help them to get the most of their medication. Also, I work in the non-medical prescribing team, and basically this is a qualification that allows nurses, pharmacists, physiotherapists, paramedics be able to prescribe medication in certain conditions within their limits of their competence. So just to recap, I've talked about how what pharmacology is, and the two main parts of pharmacology: pharmacodynamics and pharmacokinetics. And we've talked about how drugs are able to target their parts of the body that they are working at, and also just some of the issues around why it's important as a healthcare practitioner. Okie doke. If there's any questions, I'm happy to answer. So for the non-medical prescribing course, it is a postgraduate qualification, and we basically look at the legality of prescribing. We look at pharmacology calculations. We look at responsibility and accountability. While there is one, it is a double module course. We basically cover the whole areas of prescribing. So with coronavirus, it binds well. We with the information we've got, we believe it binds to a receptor called ACE, which is angiotensin converting enzyme, and it's able to bind to that. Or more specifically, the receptor that ACE creates. So we don't actually have a pharmacy undergraduate course at the University of Chester, but for main qualities, because it is a healthcare course, I would say having experience in pharmacy, showing understanding of main healthcare topics. It's about caring for individuals as well. And so that's really important. Having a strong science A levels is really important as well. Why are there so many individual differences? This is a really good question. So basically, everyone is different. We have different genetics, and so how we handle medication can differ. Also, if you've got any problems or any differences in absorption, distribution, metabolism, or elimination, which I talked about in pharmacokinetics, this can then change how you handle that drug. So, for example, if your kidney function isn't that great, if it's impaired, then you're not going to remove the drug out of the body that efficiently, which means that you'd have to look at lowering the dose in some situations, depending on the drug and how severe the renal impairment is. So, a good question, yeah. Any other questions? So with pharmacy, there usually is a research project at the end of it. For more questions on that, it depends on the university, and it's probably worth researching on which university has a pharmacy course, and however, if you email with the email address above for nursing, pre-reg nursing inquiries, then I'm sure someone will get back to you with that. But usually there is a dissertation with most courses. Do I have any advice? I would say if it's if they're a course that you definitely want to apply for, then by all means. I think a strong personal statement's useful. A lot of enthusiasm as well. That's really important, I believe, and interest, enthusiasm in the course you want to go for. That is something I would say. If you can get some experience as well before applying, then that always looks great. Great. So there's an interesting question about half-life. Half-life is a property of the drug in a normal person. A value would be given. Now, if renal function is impaired, then that half-life can increase. So what you would do in that situation is then reduce the frequency of dosing, or perhaps reduce the actual dosage itself, and then that would get the balance back in line. Any other questions? So in nursing, there's a large majority of placements in there. If you're talking about pharmacy, there are placements, but they tend to be quite limited. It depends on the course. The placements are important to see what it's like, and see interact with patients, and also get a good idea what it's like to be whether you're going for nursing or pharmacy. Thank you. Any other questions whilst you still got me? Okay, my laptop is telling me the battery's low. Thank you very much. And if there's any other questions, there's the email address above, or